Hi everyone, welcome. So today we're going to be talking about how to mix two insulins in one syringe, which is commonly our regular and our NPH. We are going to start by looking at a quick overview of insulins, just refreshing your mind on that. And we'll talk about these two commonly mixed insulins. And finally, we will look at the actual process of mixing insulins in one syringe. So, quick overview of insulins. We have commonly four classifications of insulin, and we have the rapid acting, the short acting, the intermediate acting, and the long acting. So the rapid acting, the names of the insulin on the days is usually Lispro, also known as Humalog. We also have Aspart, also known as Novolog. Very common thing you want to keep in mind about this insulin, if you give it, is that you have to give it with food. Pretty much make sure your patient's food is ready and to go, because this insulin has a very fast onset. Usually within 15 minutes, it's already working. So if you give it and your patient doesn't have a food nearby or they're eating already, it might really drop their blood sugar level and will go into that hypoglycemia state, which we don't want. All right. And then we also have the short acting, also known as your regular Humulin R and Novolin R. This is the insulin that we can also give IV. Commonly, our insulins are given into the subcutaneous tissue, which is your fat layer, which could be in your abdominal area, your arm, anywhere you have that good subcutaneous, layer. But we can give this one IV, the short acting, aka the regular, if our patient has DKA, which is diabetic ketoacidosis, or they have HHNC, and we want to lower their blood sugar faster, we can give the short acting IV. We also have the intermediate acting, also known as the NPH. We have the Humulin N and the Novolin N. You will notice that the short acting and the NPH, they are kind of like similar. The difference is Humulin R represents regular and Humulin N represents the NPH. This insulin is cloudy in color, the intermediate. It's the only insulin that comes as a suspension. So it does appear cloudy. That doesn't mean it's expired. That's the way it naturally looks. Of course, you should check the expiration date to make sure it is not expired. But every other insulin does come in a clear appearance except the NPH, which will look cloudy. You usually have to roll it and make sure that it is thoroughly mixed before you give it. Finally, we have the long acting, which is Glargine, also known as Lantus, and Detamir, also known as Levemir. Usually, we give this at bedtime, although it might be given at the start of the day so it can run throughout the day, because it usually has a duration of about 24 hours. All right. Big thing with this insulin is you should never mix it with other insulins in a syringe. You have to give it by itself because it doesn't have a peak. It has a different mechanism of action. So if you mix it with any other insulin in the same syringe, you're really gonna mess up the way it works. So you need to usually give it by itself. All right. So that's just a quick overview of these types of insulins that we have. So now let's talk about those two insulins that we would usually mix together in a syringe. Anytime we'll talk about mixing insulins in a syringe, there's two particular ones we're talking about, and that will be your short acting, will represent that by saying it's the clear one because it does look clear in color, and your intermediate acting insulin, I just told you that it looks cloudy in color. All right, so your short acting is your regular, your Humulin R and Novolin R, and your intermediate acting is your NPH, also known as Humulin N and Novolin N. So we would typically and can mix these two insulins in one syringe. In case your physician orders both of them to be given to your patient, instead of pulling them up in different syringe and having to stick your patient twice, you can just mix them in one syringe and just administer them to your patient at one time. So finally, we're going to look at how to actually go about mixing these two insulins in one syringe. So we would usually mix your short acting, like I mentioned, which is your clear, also known as your regular, and your NPH, also known as your intermediate acting, which is cloudy. We can put this in one syringe. Talking about syringes real quick, your typical insulin syringe is the more common one is the 100 unit. So unit is our way measure insulin instead of milliliter or liters. We use the word units. So we have the 100 unit, we have the 50 units, and the 30 units. All right. So depending on the sum total of how much is to administer, you can pretty much figure out which one to use. All right. Your facility should pretty much have these different units of insulin syringes, and that gives you an idea of which is best. So now let's go into how to mix these insulins in one syringe. I like to use this mnemonic called Nurse Richie RN. All right, because it's a word that can be easily remembered. You're a nurse, so think about Nurse Richie. She's an RN, and she will help you to always remember how to mix your insulins in one syringe. So the letter N in nurse represents your NPH, which is cloudy, and the letter R will represent your regular in Richie. And also R in RN represents your regular again, and N represents your NPH, which is cloudy. So Nurse Richie tells you how to put her in your insulin syringe, into the insulin vial rather. So you will usually inject the air equal to the amount of units prescribed by the physician. You would pull that into your plunger. You'll put your plunger back with your insulin syringe, and you will push that empty air into the MPH first, and you would just withdraw your syringe without withdrawing the medication. And you will go back into your regular insulin and push also the equal amount of hair that has been prescribed into that. And while you're still inside of your regular, now in RN, you will pull out the prescribed unit, you would withdraw that, and you will go back into your MPH and also pull out the prescribed unit from that. All right. This will make more sense as we go. So let's look at a sample prescription. So let us say that the doctor has ordered 5 units of Humulin R insulin, which is your regular, and 25 units of Humulin N insulin subcutaneously 30 minutes before breakfast. So we have 5 units of regular, clear, 25 units of MPH, cloudy. Sum total of this will be 30. So I'm expecting that I will have 30 total units of insulin in my syringe by the time I'm done pulling this medication. So because the total units of insulin we're using is 30, we can use the 30 unit syringe, or we can use the 50 unit syringe, all right, to do this instead of using the 100, because that's a lot, right? So first thing you would do is to verify your prescription we just did. We have 5 units of regular, 25 units of NPH. All right, it is verified. You want to gather your equipment to do this. So, of course, you need those two insulins, the regular and the NPH. Make sure you check the expiration date. Make sure that's exactly what you have. You need to wash your hands. Again, check the expiration date because they could be expired, right? And then your NPH, remember, it's going to be cloudy. So you want to make sure you roll it. It's a suspension. So you want it evenly distributed, but you don't shake it. Don't shake the insulin. You're going to put air bubbles in it, and that's not good. So instead, you just put it in between your palms, and you can roll it and roll it and roll it until it is evenly mixed together. Now you're going to grab both of those valves and wipe the top off with an alcohol pad so it is clean, and you just let it air dry by itself. All right. When that is done, now we're going to go into how to pull out this medication. So the first thing you're going to do, going back to our mnemonic again, Nurse Richie. All right. So nurse, so N is NPH. We said we're given 25 units of NPH, right? And 5 units of regular. So what you're literally going to do is take your empty syringe, pull your plunger all the way back to 25. All right, now you have your plunger pulled all the way back and you have that insulin filled with air. What you're going to do is push all that air of 25 units into the NPH. Why do we push air into into the valves first? We push air into the valves first so that we, because our valves are usually sealed by is vacuum sealed. So if you don't push air first into the valves, it will be very difficult for you to pull out the insulin that you need, and you might end up filling your syringe with just air bubbles. All right. So by pushing air into your valve first, you create space to allow for the exact withdrawal of what we just pushed in. All right. So go ahead and pull your plunger to 25. Push it into the NPH, that is nurse. Do not withdraw the insulin yet. Just pull out the needle, empty like that. Now pull back again to 5 units of insulin of regular in the empty syringe, because we're giving 5 units of regular. And you go ahead and also and push these 5 units of hair into the regular. All right, we just fulfilled Nurse Richie, and we're left with the hard end part. While you're still inside your regular insulin valve, you will invert it. As you can see, moving on to this other side, you would invert that valve and withdraw the 5 units of regular that you need right away. All right, so you leave your syringe in there, turn your valve upside down, invert it, and withdraw the regular um, units, 5 units of regular insulin. And when you're done, you would draw your syringe, and you will go into your NPH. Inverted also will add to take out 25 units of NPH, right? So 25 plus 5 is what? 30. So you just go into your NPH and make sure you pull all the way to 30. All right, that means you now have 25 of NPH plus the 5 of regular that you have put out previously, for a total of 30 units. And that is how you would mix these two insulins together. So the first thing you do is put hair in your NPH, so nurse, put hair in your regular Richie, draw out your regular R, and then draw out your NPH N. Nurse Richie R N. That would always help you remember the order in which you should do this. All right. I hope this was helpful, and thank you.